Good day to you all. My name is Dr. Marvin Venge. So as we all know, Covid-19 presents as someone who has flu-like symptoms, which can be a cough, nasal discharge, shortness of breath, and you also have a fever. So we have three categories. We are going to have the mild cases, the moderate cases, and the severe cases. So the majority of patients, about 80%, will be asymptomatic or we have mild symptoms. These patients are able to self-isolate at home if the facilities permit, or they can go to isolation centers. Then the other 20% that is moderate to severe disease, and those that have comorbidities that include your hypertension, your diabetes, obesity, chronic lung disease, kidney disease, those that have cancers, you then need to be monitored more closely, and you are usually categorized as moderate to severe disease, and you should seek healthcare advice. When one has had a positive DNA PCR, which is our diagnostic tool, then you need to self-isolate and be managed by your doctors if you are in the severe form or the moderate form. If you are mild or asymptomatic, you then need to stay at home or self-isolate. So initially, when COVID hit us hard, for de-isolation or for someone to be considered as recovered, we used to say that you would need to have 2 DNA PCRs done at least 24 hours apart. So if you have one done on a Tuesday, then you skip 24 hours, then you have another DNA PCR done. If that comes out negative, then you are considered as recovered. But the current WHO guidelines that we are now using actually have sort of relaxed a bit or done away with the exit DNA PCR. So if someone is asymptomatic and there's a positive DNA PCR, this asymptomatic person should self-isolate for 10 days. After the 10 days, they are then considered recovered, and there is no need for them to have a repeat DNA PCR. If someone is symptomatic, that is those that have flu-like symptoms, who are coughing, we have shortness of breath, we have a fever, what's supposed to happen is you're supposed to self-monitor, or you're supposed to be monitored by a healthcare worker until you are asymptomatic. Then after the period of asymptomatic, you then add 3 more days, which is 72 hours, for you to be considered as recovered. So what it then means is, if you have someone who is symptomatic for 13 days, then on the 14th day they become asymptomatic, you are then supposed to add 3 days from the 14 days, so that at day 17 they are then considered to be recovered and can be de-isolated.